deliver essential health services and nutrition services while responding to the pandemic, a global health emergency. 21 million children missed out on routine immunization in 2021. That's a shocking number, I find. And we can see at the moment that the climate crisis, the global hunger, malnutrition crisis, but also increased volumes of conflicts are further affecting children's rights to health and nutrition. And what we as Save the Children think we need to learn from these, from COVID-19 and other crises is three key things. We need to strengthen health systems with a primary healthcare approach to really reach those furthest left behind. Secondly, we believe that we need sustainable and adequate funding for health, especially for health systems and healthcare workers. And thirdly, and I speak for a child rights organization, we believe children's voices need to be consulted and heard at all times. What is the role of Save the Children and other NGOs in furthering global health goals? We have, and we see ourselves as fulfilling three main roles. Firstly, that is as an implementing partner of WHO, of governments, of other global health funds. We bring in evidence from the 118 countries we work in worldwide. Secondly, we see ourselves as advocates for children's rights. So we ask for legally mandated spaces by governments, but also by WHO, by other global health funds, to really increase children's participation and youth participation. And we're happy that we could bring many children to UN General Assemblies or the Human Rights Council. And thirdly, we hold governments to account to deliver on the right to health. And I would like to finish with a question to Dr. Tedros. We can discuss this maybe later in the panel discussion, which would be, how do you and the WHO plan to increase children's participation in WHO processes? Thank you. Got a few ideas, but we can discuss that later. Thank you.
Thank you, Marionka. I hope the ideas are crazy, because that's what Dr. Tedros is looking for, what he calls the crazy ideas. Let me move on to FIFA. Through the pandemic, CSOs in the ACT Accelerator brought crucial expertise throughout on the need to address structural barriers to vaccine and to expedite access to self-tests, intervening when there were blind spots. What are the biggest lessons coming out of the CSO experience in the ACT Accelerator that should inform future pandemic response mechanisms? FIFA, floor is yours.
Thanks so much, Gaudens, for the question, and happy to address it. But before I go into the lessons, I think it's important for us to acknowledge the difficulties and disrespect that some Black and brown people have faced in getting to the summit. So I think it's important for that to be seen. I think one of the biggest lessons is that while there are large organizations during the COVID response that really valued civil society expertise, and I want to talk about FIND and Global Fund in particular, and of course the WHO, and who we worked really sort of productively through the pandemic with, there were, quite a lot of struggles with organizations that are perhaps less familiar with civil society expertise. And one of the blind spots that came up multiple times was this impression that civil society wasn't agile, wasn't efficient. When in the ACT Accelerator, it was CSOs that raised access to Paxlovid and test and treat programs a full 8 to 12 months before Paxlovid was even registered. So, that's just one example. Another example was in the Health Systems and Response Connector on the ACT Accelerator, which actually a lot of people don't know about because of the focus on the COVAX predominantly. But the fact is, in these discussions from the start, we said, look, you need to invest in community health workers to bring forward vaccine uptake and diagnostics uptake and Paxlovid uptake. And it came to 2022 when suddenly the voices came out and they were like, oh, people are not taking up these technologies. And we're like, we told you in 2020, you needed to invest in community health workers. So look, the idea that civil society is not viewed as agile or efficient when we do raise things much earlier than sometimes those in global health agencies do is something that really needs to be paid attention to. We also, throughout the pandemic, kept emphasizing the need for equal intellectual partnership of LMICs. And this is incredibly important to contextualize approaches because it's only with equal intellectual partnership of Global South that we can achieve equity. So as time passed through the pandemic, it became quite evident that some quarters viewed civil society as some kind of monolith, with comments coming our way about, oh, we're shocked that you're technical. We're shocked that you went to the same schools that we did. And even if we didn't, civil society brings expertise from countries that address structural barriers in terms of access to COVID tools, perhaps those sometimes that those in Geneva and New York might not have. So there's something that points to something archaic and sub-democratic about our global health architecture. And I want to talk about the World Bank, FIF, the Financial Intermediary Fund in particular, which took us so much pressure. We were struggling constantly to get CSOs on the board, and now we have two CSO representative with voting seats. But in reality, CSOs have roles on the boards of UNITAID, on the boards of Global Fund, and their knowledge is valued there. Ultimately, we need to see more democratization in the global health architecture in terms of civil society expertise. And we'd like to see WHO play a stronger role in emphasizing that in all partnerships it creates with any agency, whether it's the World Bank or whoever else, that WHO comes together with CSOs. And it's really great that this CSO commission with the WHO has been created. But I also want to see member states step up with contributions to fund civil society to be in these spaces. Like under the ACT Accelerator, I received $8,000 for the whole year, and I've been in hundreds and hundreds of meetings on the COVID response. So you know, the idea that we are not adequately funded for our work is something that's really quite important that member states really need to focus on. I had a colleague request, please talk about long COVID. So I'm going to quickly say that we need to constantly talk about long COVID and progress into work on long COVID on that. And from all of this, my question to Dr. Tedros really is, in terms of how do you see WHO's work with CSOs going forward in terms of pandemic preparedness and response and what the WHO CSO relationship will be looking forward? I end my comments and looking forward to your thoughts, Dr. Tedros.
Thanks a lot, FIFA. Let me move to Kurt. Kurt, you're living in Argentina, a middle-income country, where the health systems are usually not so well prepared for confront unforeseen emergencies and the resources are scarce. From your perspective, which should be the role and engagement of CSO in the health system strengthening and primary health care? Which were the lessons learned from the pandemic response and how will it impact on the GHI 2030 fulfillment?
Thank you very much, Gaudens. I'm here as part of Fundación Huésped, which is an Argentinian organization that has a wide regional work in Latin America. Latin America, I must say, is the most unequal region in the world. Many countries are seen like Argentina as middle-income countries, although huge sectors of the population live in great poverty. In LA, the pandemic hit very hard. Peru has the highest rate of per million diseases in the world, and Brazil is still in the top 5 of death. During the last 2 years, CSOs and community health workers were compelled to assist the most vulnerable populations. Fundación Huésped, my organization, continued regularly assisting persons living with HIV, sex workers, and transgender persons, and strengthened our work with migrants and people living in slums that also required basic nutritional funding and health assistance. But since 2017, here in Berlin, the Health Working Group of the Civil Society 20 warned the G20 about the risk of facing new health disasters if antimicrobial resistance wasn't addressed properly. These warnings were repeated in each G20, and as we said in Italy last year, The health emergency exposed the lack of preparedness, the impact of decades of insufficient development of public health systems, and the stringent limitations in terms of properly trained and salaried health personnel, as well as access to essential medicines, vaccines, diagnostics, and related health technologies. COVID-19 did not appear unexpectedly. WHO and the international community had the knowledge and tools to make SARS-CoV-2 a geographically controlled epidemic. But for mainly political reasons, and despite the evidence that a highly contagious new pathogen was spreading around the planet, it was not until March 2020 when it was characterized as a pandemic. If we learned something the last 2 years, is that after COVID-19 and the enormous cost in lives and well-being, business as usual is not an option anymore. COVID-19 has put the spotlight again in linkages between health system capacity and risk management, and the need to have an effective outbreak response while maintaining other essential services, including mental health, an issue that became more urgent than ever before. It has also revealed the deep structural inequalities within countries and a constant overlap between fragile public healthcare systems and debt. In the global south, close to 600 million people will still be in extreme poverty by 2030, more than double the target set out in the SDGs. According to a World Bank report, 64 low and middle income countries spend more on external debt payments than on public health care. WHO has a key leadership role in addressing and promoting the health and human rights dimension of global issues, working together with other sectors, and especially with civil society. At Fundación Huésped, we understand the importance of a new pandemic preparedness treaty with specific funding to deal with the big health challenges of our time, and welcomed it. But the support of local civil society organizations should be a concept written on the treaty itself as key actors to reach and link to care for the most vulnerable populations, not leaving anybody behind. From the use of emergency powers and vaccine equity to the protection of marginalized groups, a new binding legal instrument on pandemics is potentially significant and far-reaching. It is critical that any such process built on core human rights standards and gender equality involves communities, civil society, and human rights organizations. And talking about what Dr. Tedros mentioned about the Civil Society Commission, including those not on official relations with WHO. As part of the advisory group of the C7, we demand that WHO keeps the promise and supports member states to truly achieve inclusive, equitable UHC. As we look ahead to the 2023 United Nations High-Level Meeting on UHC, we hope to see significant progress in the goal of increasing public investment in strong healthcare systems, strengthening primary healthcare, and implementing measures for equity. As Frantz Fanon said, each generation must discover its mission, fulfill it or betray it. Now it is our time and responsibility. Thank you.
Thank you very much, Kurt. Last but not least, Kellyn, I know your passion is the health workforce, as it is essential to global health in general and even more during a health emergency. Therefore, what do you think were the challenges faced by health workers organizations to engage in the COVID response, and how do we mitigate those to achieve health for all and prepare for the next pandemic? Kellyn, the floor is yours.
Thank you very much, Gaudens, and hello, everyone. It's definitely a pleasure to be here, but maybe I will first ask a question to the audience here in the room. By a show of hands, who here considers themselves a healthcare worker who was caring for a patient during the COVID-19 pandemic? Please raise your hand really high. Wonderful. Thank you very much. So thinking about the health workforce, I think what I am going to briefly tell you about is going to resonate with each one of you who raised their hands right now. And I certainly hope that the colleagues who weren't at the front line will also, hear me and understand that the challenges that were quite significant. So if you remember at the beginning of the pandemic, there was a brief stint of applause for health workers all around the world. This was absolutely wonderful. It lasted a very short period of time. After that, we went back to the violence, to abuse, to lack of PPE. A personal story for myself, being chosen as a young physician to be at the front line of caring for COVID patients, where being told that I need to wear my mask for 10 days or more until it falls off, and then we will see if there is another mask. And I was working in a high-income country, mind you. So other than that, we saw health workers become victims of misinformation, also severe rates of burnout, health workers becoming themselves ill, questionable access to vaccines varying from one country to the other. And at the end of the day, per WHO numbers, we lost 115,000 health workers to the COVID pandemic. And I think it's important for us to think about that number, to reflect, and to think about the colleagues, family members that we lost to that pandemic. And I'm not saying by any stretch of the imagination that the lives of health workers are more valuable than any other life. But it's important to think about how do we protect our own people so that we are able to care for others. If you recall, at the beginning of the COVID-19 pandemic, there was a physician from China, an ophthalmologist, Dr. Wenli Yang, who tried to alert his colleagues about a mysterious pneumonia that was going around. Unfortunately, he ended up dying from COVID-19, and his message didn't go either very far or quickly enough. I would tell you today that despite our most advanced, our most well-researched surveillance systems and mechanisms that we can come up with, that we can fund, it will always take a clinician somewhere around the world to realize that there's something going on in the community and my patient population, that we need to do something. We need to figure out what's going on. Health workers are absolutely critical at every stage. When we're trying, if we switch gears a little bit, other than the day-to-day challenges of frontline health workers, which, by the way, have not really changed much until today. Maybe COVID is not what we see every day in the hospital, but we're still having some very, very similar challenges. As far as being involved in the global response, my own personal experience belonging to several health workers organizations is that involvement of healthcare professionals at every level, from students to early career to fully trained healthcare professionals, was really after the fact. So when we were invited to join the table, it was several months after various guideline development groups, expert groups had been working. And then suddenly we were told, well, you're welcome to join us, after a lot of decisions have been made that impact our day-to-day work with patients, patient care, and in our ability to care for them the best way possible. So when it came to high-level decision-making, we were not really included as groups. Yes, I can tell you that every expert group has a healthcare professional on it, and more than one. But if you think about the way we select experts, it's usually folks who have done a tremendous amount of work in their own local context, and they come in, and I heard that, not to say anything against Canada, I absolutely love my Canadian colleagues, but I heard this repeatedly on a specific expert group that affected healthcare workers significantly. This is what works in Canada. What works in Canada probably has less than 5% chance to work for the rest of us. And we really need to be cognizant as to what do healthcare professional groups bring in as a collective on the global, on the regional, and even on the national level as far as expertise. And I certainly echo FIFA's comments. There is a lot of experience, a lot of expertise in civil society, in healthcare professional groups as a whole, that bring in a completely different perspective about what's feasible, what's possible at the front line. So what I would like us to think about today, and maybe not challenge you all, but think with all of you and with Dr. Tedros, how do we systematically include healthcare professional organizations in various settings, in various decision-making spaces, as well as expert groups? I think that the Civil Society Commission is a great step. The WHO Youth Council is an even greater step. But what I would like us to reflect on today, and especially because my regional director is also here, how do we ensure that those mechanisms actually lead to involvement beyond the 20 or 30 organizations that are selected? How do we include those who were not selected for any reason, who are active on the regional level or on the national level, and make sure that their voices are heard? And that would be at every level. Is it on the expert level, on decision making, etc.? So that would be my question to Dr. Tedros, to the WHO colleagues, and to the group at large. How do we ensure broader representation and truly effective voices in the CSO Commission moving forward, as well as the Youth Council? And I'm also happy to reflect on that a little bit more based on prior discussions. Thank you.
Thanks a lot. Thanks a lot, Colleen. You're from Lebanon, aren't you?
I am.
Yes. Very, very rich start. Thanks to all the four of you. So I would like to invite Dr. Tedros for a first reaction to that, but then also others to react before then we open the floor for the audience.
Yeah. Thank you, Gaudens, and thank you to our fellow panelists. Excellent input from all of you. And of course, you ask questions. I know you know the answer, but on the how do we increase children's participation in order to give time to others, I will try to be very brief. How do we increase children's participation? One, we have the Civil Society Commission now, which is going to be established in 2023. The Youth Council already done. And then we have signed agreement a couple of weeks ago with Mr. Gulo Mohammedi, the president of WUFNA, the World Federation for UN Associations, and will be building a WHO model. These are older children, of course. The setup will be like the World Health Assembly, and then they discuss about health, and they can even pass resolutions or make decisions that could be forwarded to the assembly. So we want that to be expedited, and we want to have the first meeting of the children in before the next assembly in May 2023. So the answer is we will collaborate with you, we'll collaborate with our youth council, and also with the Civil Society Commission, which is, of course, moving forward to discuss on how to engage children more. But from WHO side, we believe that all parts of society should be mobilized. And that's how we can deliver result. And that's why we're working with civil society and making it systematic. We're working with the youth, making it systematic, institutionalized, and working with children, same time making it more systematic. So look forward to working with you, Marionka, especially institutions, I mean, like yours, organizations focused on children are important, and we will use your experience to have a successful model WHO, so children can participate, but they can also participate through other means. If you have ideas on other types of engagement, please feel free to suggest. Like Gauden says, crazy ideas are welcome.
I'm not sure whether I can intervene now or.
That's right.
Okay.
I'll give you the floor just
That's fine.
Okay.
Yeah, thank you very much for the ideas already. We're looking very much forward to working with you now and in the future on your ideas. We these aren't crazy ideas, but what we think first and smaller steps would be to involve children more in World Days, for instance. A second idea that could be taken up by the WHO is to include children's voices in policy reports that you're issuing, and anything advocacy related, which is open to the public. We are, for instance, doing child hearings, listening to children's voices in countries worldwide, and we're happy to work together with you on that. But also maybe child safeguarding processes by the WHO that could be taken up, and we're also happy to provide for our expertise in regards to that. Thank you.
Okay, thank you, Marionka. These are very helpful. So we will consider those and other things, but we're very open. We want to do anything that will help to benefit from WHO and from global health. And then on FIFA, what you raised on civil society participation, we are for civil society participation. And I need to be honest with you, some of the challenges are, for instance, I can tell you the initial stages as soon as I started as DG, when I asked some colleagues we should involve civil society, then some were not convinced and they were saying, no, this is a science-based organization and should not be influenced by the civil society or private sector. The text, the guidance, the norms and standards we prepare should be really clean from any influence. Then I said, but they can help us to make a very good guideline, because they know what the community needs. And of course, the guidelines should be based on science, but without understanding what the beneficiary wants and get support in understanding that, it wouldn't help. So why not we try? Anyway, one of the successful ones now is TB. They get involved in guideline preparation, and the inputs they make is really very important, and we're involving others. So there was that kind of mindset which is changing now, but we need to really continue to push, because not only in improving guidelines, the other thing we discussed at that time was, okay, we should involve them because there will be this benefit. But at the same time, we're going to sell this product, and the civil society can help us actually in selling the products, because there is this mentality also. WHO should not be like advocating and pushing and being political. If you have a product and you're not political to sell it or market it, then why do you even have the product in the first place? And so we have to sell it ourselves, but the support from civil society would even help us to market it in a better way, because you have the capacity to do that. So things are improving. We will continue to work with you more because of the reasons which I have said. And even private sector was more sensitive, conflict of interest, this or that, but we're working with the private sector now, even having a common goal of eliminating trans fat by 2023. And we meet with the food industry, which was a taboo some time ago. And this is based on SDGs. In this SDG document, the world had agreed that it will not be implemented without the participation of the civil society, the private sector, the government, the academia. You have it. The whole world should give its support. Okay, there could be conflict of interest, there could be risk, but you don't stop from doing something or aspiring something because of fear of risk. You mitigate the risk and move on. So that's the way, and that's what we're doing, and we will do more participation, not only for pandemic preparedness and response, in really promoting health, in building primary health care, which should be the foundation of the strong health system, as you were saying earlier, in pandemic preparedness, in research, in digital health, in everything, to fight communicable diseases, non-communicable diseases, to promote health for maternal and child health, and so on. So you have my and WHO's full readiness to work with civil society, because we see now the advantages clearly, and we should even expand. That's why we have the commission now, which we look forward to build, and then more what do you call it, more institutionalized, so it can be sustained. We don't want things to be reversed because you can talk and you can agree informally and so on, but unless things are formalized, institutionalized, they cannot be sustained. So that's what we're doing. And then I think I had one question from Aline also on the, maybe I will invite my colleagues on that. What happened to health workers during this pandemic is really heartbreaking. Initially, as you said, Colleen was excellent. Every night, citizens applauding and appreciating the role of health workers, and then started to really decline the support and, as you said, even violence. And now, as part of the Great Resignation, health workers are resigning from their work in big numbers. And that's real. And we have a work now to do, not only to fill the gap of those who are leaving, but even the gaps we had even before then. So the focus on health workers is becoming even more urgent than we believe. And I had a meeting with my friend, Minister Karl Lauterbach, yesterday. That's the first meeting, actually, as soon as I arrived. And one of the discussion areas was on health workforce. And I see a lot of interest in many, government, civil society, and other stakeholders. And we need to really mobilize all to make sure that the health workers, starting from the dignity, the respect, and pay everything they need, the support they need, to also addressing the gaps. But we need to give all the support that needed to those who still continue to serve in that difficult environment. And then one last moment, and last thing, maybe there's some misunderstanding globally, which I just would like to say today, is on the on what Kurt said. Until March 2020, the pandemic was not, the COVID was not characterized as pandemic. Of course, the IHR, the International Health Regulation, is being, what do you call it? Revised. And we will see what revisions there will be, and your involvement will be important. But in the IHR, based on IHR, the highest declaration WHO can make is public health emergency of international concern, we call FIC. And that was done in January 30th. And this was done when cases outside China were less than 100 and there was no death at all. Then, if you remember, we started daily, after we declared FIC, we started daily briefing to the world daily. And we were saying to the world, the window could narrow. Please do everything to stop this virus. It's dangerous. And you remember, we were even saying, this is public health, public enemy number one. Let's stop it now. It's the window is narrowing. I remember there was a famous question to me from Helen Branswell from Atlanta. What's the from Atlanta? From Helen Branswell from the start, yes. Then she said, Tedros, you always say closing. The window of opportunity is closing. When is it closing? It will be closing soon. We're really worried. And then it started to explode. And then we said, what do we do now? Then we took that pandemic issue, which we normally are not required to declare. We said, okay, now we should send a strong language, because the FIC is, people are not taking it seriously, but that highest we can declare. And we should do something. And there was a debate. No, we cannot go something that we're not mandated to do, because it's only, FIC is the highest. So we have to help them understand. Otherwise, we cannot say it's pandemic. Then there were others who say, no, we should use it, because people understand when it's pandemic than when in, the FIC. Anyway, we agreed, and March, as you said, we said, this can be described as pandemic, because we were careful, because legally we don't have the even things to use for that. So we said can be described as pandemic, and the world then started to get scared, then move to action. It worked a bit late though, but now with the IHR revision, what do we do to address that? But the fix should be taken seriously when it's declared, because that's the highest, and it was done in January 30. Just want to say this, Kurt.
May I? Yes, please. Thank you. Well, I think that's past story anyway, no? But I saw also that WHO declared now the monkeypox as a pandemic.
Not pandemic, fake. Fake.
Fake when it started. But it's okay. That what I wanted to raise is really that I think that one of the roles of community is really the early warning when things happen. It happened when we had the big pandemic of HIV/AIDS during the last century, which was really the biggest pandemic in the world during the 2020 during the last century. And that was also an early warning from the community. COVID also was an early warning from the community, because when that happened, when it was declared as a pandemic by WHO, it was after the hospitals were full almost everywhere. And so, but I think that the big role that civil society has here, and that makes me also understand the importance of having a commission, as you mentioned before, with the participation of many of all the countries, and especially of those of the Global South, is that we have the possibility of being of great assistance to WHO when things may happen.
Exactly.
And that's the idea.
No, that's exactly it. So when we declared FIG, if we used it, if we use civil society to sell it, should not be just WHO alone. It could have huge impact. That's why I'm saying we have a product, then we don't need to sell it alone. One, we have to sell it ourselves. We have to promote it. We have to be aggressive. But the mobilization of the civil society could have a better impact, bigger impact. So you're right. So we should do that. If there is one issue that has to be corrected, exactly that for next week. By the way, on the monkeypox, we had better communication with civil society. Actually, we had better the discussion and listening to what they say, and was better. And for anything that comes in the future, I think this could be a lesson to use the existing power we have, which we don't use, which I have to admit that civil society capacity, we're not using it. Of course, we have started, we're better, we're making progress. But considering the huge potential civil society has, I mean, we're using just its fraction. So we have to do more. And the Civil Society Commission, better organized, will make that happen, because it has to be better organized, coordinated, formalized, institutionalized. It cannot be just rhetoric and say, okay, informal meetings, then we do mambo jumbo, we say mambo jumbo and out. If it's a commission, there will be accountabilities, there will be institutionalization of what we do, which will really help us to sustain and exploit you to the maximum, exploit in a positive way, exploit the civil society.
Thank you. Just to say, it shouldn't be only a token participation.
Exactly. That's why it's being institutionalized and to sustain it also.
Kurt, you give me the keyword, because you bring, it's always nice in discussion with civil society, you bring a huge challenge. It's so rich that forget your program. It goes longer and richer than what you planned for. Therefore, I would want to open first to the audience here. Let me take some questions here. When you, good luck. I will also then ask for those on Zoom, if you're anonymous on Zoom with a question, we will not take your question. So you have to introduce yourself on Zoom. I will take a few. Let me start at the very back of the room, please, with the first questions. I've seen one wait for the microphone because otherwise people online don't see it. We'll take 3-4 from the room, then 1 or 2. And we would also want to ask the regional director to intervene if you have some comments afterwards. Please introduce yourself and a single question, not interweave in 3 or 4 questions. There are too many others.
Thank you very much. My name is Malik Ketat. I'm a psychiatrist from Tunisia working in Germany. And I'm also a founder and leader of public health NGO in my country, Tunisia. My question here is, does the World Health Organization have a plan to guide capacity building efforts of CSO, especially in low and middle income countries? And is there any plan for the World Health Organization to engage with international donors to help integrate funding of capacity building and expertise transfer to CSO in low and middle income countries into the agenda of the CSO funding stakeholders? Thank you very much.
Thank you. Then at the very back, there was one there in front of the window. No, there, back there.
Thank you. Firstly, congratulations on taking us this far in having this dialogue. My name is Olya, and I'm the alternate North representative on FIF PPPR board, which FIPA highlighted earlier. And I'm here with my colleague Elisha from Global Health Council, who is the civil society representative for North. This is to say that we indeed are working really hard with board members to really move forward the much needed PPPR for FIF. We're working with World Bank and WHO Secretariat to get funding for our Secretariat to really move forward our work. But if I may, I would like to ask the question to Dr. Tedros about the pandemic treaty. As you have rightly mentioned, indeed, the role of the civil society is probably not fully delivered, particularly in the pandemic treaty work. My own organization, Frontline AIDS, we are part of the Annex C process, which has been very useful, and civil society is part of that. We are part of the thematic conversations. However, we still feel we're just contributing on the margins and we're not making the impact we can make. So my question is, what concrete steps you can take to increase the space for the civil society for the decision-making in the pandemic treaty process, and how we can support you in this challenging process? Thank you.
Thank you. I had here in the middle, if you come forward to the side there, and then the black young lady here. First, to your right, just behind you. That one, and then here.
Thank you. Does it work? Yes, it does. My name is Vesna Kerstin-Petric, and I'm coming from the government of Slovenia. I work at the Ministry of Health. I would very much like to know, and this is my question actually, who is coming from the ministries, or who is here sitting with us with at least local administrations? Please raise your hands. Thank you very much. This is the answer to my question, and I will now share with you my frustration. I'm working at the government all my career. I'm a medical doctor, public health professional, and there is very limited understanding what potential is in the NGOs or civil society, even in my country. But I have to admit, everything I have done in my career, tobacco legislation, dealing with HIV, and so on and so forth, obesity, has been done with the help of NGOs, most of the time with organized young people. So, Dr. Tedros, you have done a lot, and we are talking, because I'm also the EB chair. We are talking a lot about this, and I have to praise your work. There has been a lot of progress recently regarding the NGOs, but we have to do one thing more. We have to make sure that the governments understand this potential, not just the WHO and you, but the governments. And that is why I ask this question. You can see they are not sitting here. They don't listen. Maybe they would go for it if they would know about the potential. And in my country, Slovenia, there are so many good examples what can be done with NGOs. Thank you very much.
Thanks a lot. Young black lady here.
Thank you very much. Thank you, Dr. Tedros, for your comments and support for civil society. Just a quick comment that Civil society largely drives accountability and advocacy alongside all the other things that we do. One request to WHO is to embrace the whole breadth of accountability. In my experience, there is confines of what accountability is within WHO, whether you're looking at global level all the way to country. And alongside accountability, to encourage WHO, especially at the country level, to engage governments to understand what civil society brings to the table, and to help governments see civil society as partners in global health, whether you're thinking about pandemics or whether you're thinking about primary health care and other essential services. So it's really critical for that understanding, because it will open doors to benefit from the power of civil society. Thank you very much.
Thanks a lot. I see a lot more. Just a moment that I'm coming back to those. First, perhaps a short answer from my side. The question of how to support civil society with the Solidarity Response Fund, where suddenly WHO could provide funding. We have done two main initiatives. One was through our country offices to support civil society, where we could invest 5 million and reach, as Dr. Tedros mentioned, millions of people. And I know some governments are now picking up that model and starting to go further. The second was the global youth mobilization with the Big Six Youth Organization, which was also reaching to youth, and we are trying to help them to do more fundraising. So it's really in our common interest, and as Vesna was saying, to get governments understand and to get donors understand that it's worth to invest. The second part that we are doing is that's the informal pre-meeting for the World Health Assembly, where those in official relation can really debate. And there we are pushing, and we count on the EB chair to really push member states to engage in those discussions, that we really get governments and member states going. Because Dr. Tedros can push us very strongly from the Secretariat, but that's not enough. We have to jointly push member states to walk the talk with us for those engagement. I propose, Taina, we take one online question that you could give, and then I go back to answer the first round, also to RD Emro, and then I come back to the room for further questions. Taina?
Okay, thank you, Gaudens. Mainly in the spirit of that similar questions have been asked. Following, this is from Mike Podmore from StopAIDS, if I remember correctly, that he's from StopAIDS. Following up on FIFA's comments, Dr. Tedros, please can you speak to the importance of inclusion of civil society and communities with seats and votes and financial support to participate in all global health initiatives and institution governance boards? We should not have to fight to get civil society seats at the FIF. What do you see are the main barriers to achieving this? Thank you.
Thank you. Let me turn to panelists and Dr. Tedros and Dr. Almandari. Panelists, comments from your side.
Maybe one quick comment, and just a reminder to some of us who have been in the global health space for a few years. I think the comment from the colleague from Slovenia is absolutely crucial. If you recall, about 4 years ago now, I can't even remember with COVID, there was a discussion of trying to limit civil society participation, even as observers to governing body meetings. And I think that from there, we have moved to discussions about engagement, about a commission, about a council, which are actually really great. But there is a step that is absolutely missing, because that conversation may come back. So for me, when the question comes to how do we get civil society a vote and the decision-making process, I think there are so many steps that WHO and Dr. Tedros cannot take on their own. We really need member state engagement to truly recognize the importance of civil society for us to move forward from we want civil society to be out of government body meetings to we want them to participate in the decision-making process. And maybe one quick comment, just going back, Dr. Tedros, I greatly appreciate what you mentioned about health workers. But from the health workforce standpoint, we need to think at different propositions, different ideas. How many of you here had anything in their daily life change after the year of the health and care worker. I can tell you nothing had changed for me, for my colleagues. Maybe things are even worse, but people happy, we had a health and care worker year. So let's think a little bit outside of the box, because we can make so many roadmaps on recruiting public health workforce for emergencies and for the future. But if we can't keep the health workers that we have, we're never going to be able to build a health system that is able to respond to pandemics and emergencies in the future. Thank you.
Good. Yes, I would like to answer a little bit about what this lady doctor mentioned about the very low participation of governments in these kinds of meetings, where even if we have Dr. Tedros present, we don't have any other government officials here. And that is happening everywhere, really. When you have even a meeting with government with the health officials in different countries, public health doctors don't come in and don't participate, and that is something that we have to change, because really the community health workers are a very, very important workforce in all countries, and mainly in the global south, and they are solving many of the gaps that the health systems are really having. I just wanted to add that.
If I may say, it's not about civil society participation, it's about government participation in civil society dialogues that we have to really push.
Can I add something to that? And just a short one, 2 points. It's about equal participation, meaningful participation. So not just having a tick box exercise for civil society engagement, both by governments and WHO, but also it's at the same time having clear and transparent processes right at the beginning and established from the beginning. I think Colleen mentioned it, we shouldn't be included after a year and a half, but right in the beginning. And it should be clear how we can influence decision-making processes. Thank you.
Thank you.
Yeah, and just briefly from me, really appreciate the intervention from the doctor from Slovenia. And I think at the core, it's about a discussion of how civil society are perceived, and it's on the fault of both sides, perhaps. I'm biased, so I would say it's less our fault. But this mindset that we're not science-based, or the mindset that we're, many development banks told me through the pandemic, we didn't know you had PhDs in civil society, and I was like mind blown. But it's not just the PhDs; it's the expertise from the ground. So there needs to be a philosophical shift into the understanding of what expertise is. And through the pandemic, we had conversations with the government of Germany, government of Indonesia, but these were the most frequent, and this needs to change.
Just to cover the lady from Slovenia, Dr. Vesna Petric, is actually the boss of Dr. Tedros by chairing the executive board. So I think we have a window of opportunity to really work hand in hand with you, Vesna, on giving a strong push together from us, from Secretariat, from you, from civil society, from you as chair of the executive board, really to push member states to come along on those. Dr. Al-Mudari? Yes, please.
Thank you very much, Gaudence, for your moderation of this important discussion. It is really very stimulating. There is a lot to say, but I'll be very brief. In fact, I'd like to start by sharing, the WHO definition of health that has been given 10 years, more than 30 since its establishment, which is saying that it is a complete state of physical, mental, and societal, well-being, and it is not just, absence of a disease or infirmity. This has led WHO to creating and developing a lot of frameworks, initiatives, and with a very nice terminologies, like, for example, One Health, health and health policy, multi-sectoralism, which is really pushing all stakeholders, but definitely the member states, but all stakeholders to be actively engaged in the development of the health of the people and the well-being of the people. Now, this will lead me to important points that have been initially shared by you, Viva. I'm really very glad you mentioned it when it comes into engaging the civil society organizations. One of them, And the most important one is the weak commitment of member states in engaging the civil society organizations.
Right.
We have many excellent success stories from around the globe, but unfortunately, these are, individually developed and individually endeavored, success stories with maybe a very minimal support from member states. And the comment mentioned by our doctor there on the back, just asking how many from member states attending officials is really another strong sign and signal that member states are not doing their part when it comes into actively engaging civil society. And number two, these success stories, if are there, never documented, and if it is documented, it is never shared and disseminated to many of us. It just kept within that same locality. So I think there is a weak documentation, and if there is a documentation, there is a weak dissemination and sharing the lesson learned so that we all can learn from it. But I'm really happy to hear that we are moving in the regional office under the umbrella of the vision Health for All, by all. We cannot reach Health for All without engaging everyone, even children at school. We have to engage them. Farmers, everyone should participate actively in developing the health and well-being of everyone around the globe. So thank you very much for that.
Thank you very much, Dr. Tedros.
Maybe other colleagues, if they would like to comment from WHO, because that was what he said.
Yes, please. No.
No?
No.
Okay. why not?
I'm coming afterwards.
Yeah,
Dr. Tedros,
okay.
or you want more questions? Let's start on this side.
Thank you very much. This important conversation is happening here, but deaf colleagues are not able to access the information. So I would request WHO to recruit sign language interpreters and have sign language interpretation of every conversation, every event that WHO holds. Thank you very much.
Thank you. Here in front.
Yes, good morning, and thank you for calling us all today. I'm Harjot from IPPF and also here with my friends from CSCM ACT and CSA Alliance for Human Rights. And I want to thank the regional director for sharing definition of health. And on this, my question is that how are we applying this definition to long COVID? What is the plan? And thank you, FIFA, for highlighting about it. But we need, COVID is not over with long COVID coming, and what is WHO's plan on that, and how are we engaging CSO and communities in planning for it, especially from Global South, because we want to be part of co-creating and designing this model for future. Thank you.
Thank you. I take here, lady in the second row.
Hi, thank you. My name is Jennifer Ho, and I work at the regional level in Asia Pacific with an organization network called APCASO. My question today, and because I work at the regional level, it's wonderful to hear the global WHO commitment on working, engaging with civil society. One of our biggest challenges actually at the regional, at the country level, how are you planning on working with your regional and country offices to support civil society engagement and participation, especially in the context of shrinking civil society space? And we're seeing more and more of that in South and Southeast Asia. And what are your strategies, especially for organizations in the network that we work and promoting the rights of key and vulnerable population? I would be really great to hear a little bit more thought on that. Thanks.
Thank you. Let me try to take it from the lady back there.
Hi, my name is Liza Dunn and I work for Bayer, and I have a question about civil society in general, since often civil society determines how governments interact with international organizations. And we've seen a lot of distrust build because all of the experts had major disagreements with how this pandemic should be managed publicly. I think that there's been a loss of trust in lots of our really important institutions. And I'm trying to figure out the best way, and if you have input on what the best way to re-engage civil society so that we can build trust in the setting that there had been so many disagreements among experts about the management of this.
Thank you. There, just to the right. There and then behind. Or in whichever order. Behind, just behind you. And then the one you've seen just before.
Thank you very much. My name is Aras. I'm from Kurdistan region of Iraq. I'm a medical doctor, brain physiologist, but I then left the medical field, clinical field. Then I started to have a TV program on the most popular TV in my country. We were fighting against ISIS. And then when we finished against ISIS, then COVID-19 came. The people in my country thought that we have to fight against COVID-19 just like we have fought against ISIS. So first, this is after they believed, after a long time, trial of civil society and media to make them believe in COVID-19 because they were thinking that there is no virus, there is no COVID-19. After that, there was shameful, like a stigma to declare that I have signs and symptoms of COVID-19. So in my TV station, because we have a health department, we worked with civil society, with NGOs to have 2 daily programs, TV programs, like politics and news channel, but I will come to the question. With two TV programs daily to make people educated and deal with COVID-19. Fortunately, after about 2 years of pandemic, we have 1,500 deaths in 6 million population. But we have done all of this without any support from WHO, from the government as well. Because WHO told us that we cannot support local civil society. You have to connect with an international one, then we support you indirectly. My question is, when we were doing all of this, we were having about 2 million views on social media daily, but WHO was busy with printing posters, leaflets, booklets that is not reaching the people never. And local NGOs will
please come to the question.
Okay.
That's also...
The question is, why WHO cannot support first media, second local NGOs, and WHO supports and gives fund, provides fund for some posters, some booklets, some extra. The second question is, if we talk about children, we have to have them educated. In a country like my country, in Iraq as a whole, in the countries in the region, there is no any programs in the government, in the education process, in primary schools, for example, to educate them. And
please
another question is, what could be...
Thank you very much. We had one question per... And I think there were online questions. Can you take one and then we take one on this side of the room? If you could come over with the microphone, Tina.
Yeah. Thank you. Actually, there's a couple of questions that were related to the health workforce, but I think Colleen has already addressed them. And then there is a question or comment from the Third World Network, Gio Kling, related to the role and contribution of civil society cannot be fully equated with that of industry, that have some fundamental differences, even though we all profess the same big goals. There is good reason why the WHO Convention on Tobacco Control explicitly puts the tobacco industry at arm's length. So the comment is really sort of making sure that the difference between the private sector and the civil society is taken into account. I think that's all for now.
Thank you. Lady there in grey. Just speak.
Okay. Hi, I'm Samantha Rick. I'm from AVAC, Global Prevention for HIV/AIDS. And much of the last 2 years, understandably, we've heard a lot about preventing future pandemics, but even in this room, we talk about current pandemics as if they were in the past, using past tense verbs. So things like HIV, which have been raging for 40 years, how are we going to integrate the response to pandemics that are killing people now with preparing for pandemics that we think are going to come later? Thank you.
Thank you very much. I see that we could go on another 1.5 hours. We have just very short left. So I will go back to the panel and Dr. Tedros, but perhaps I would first start with a few questions which were asked. Actually, indeed, in WHO, we need to educate our staff also stronger, and we are working on that. For small engagement, there is no other needs that can be done at the local level. Our big constraint is often are two. It's that education that we need to do, and the other is resources. Realize that we are relatively small. Don't put over expectation on WHO, but we are in the process of finalizing a civil society engagement strategy for the Secretariat, and part of that will be the internal education at all the 3 levels of the organization of really engaging systematically, subject to the available resources. And to that last comment Tina was just reading out, the private sector engagement strategy will deliberately be separate. Yes, we need strong engagement, but there are to some extent different modalities in how we engage, but we need to engage with civil society, and we need to engage with private sector. So we are doing that internal educational work also. With that, let me turn to panelists for respond, and then again to WHO colleague and Dr. Tedros. Panelists? Any comments from your side? No obligation.
But I mean, are you talking about the questions?
Not the questions, yes.
No comment.
Okay. Artie, did you want to respond from the questions which came up?
With us again. In fact, it is just about the question shared by our dear colleague, a doctor who's running a program, TV program. I appreciate his transparent remark, but in fact, we have been, as usual, been working with member states as our official authority in the country to work with some other countries. They have different unique systems when it comes into the relationship of WHO and the country itself and different, stakeholders. So we have been running collaborative work with the Minister of Health in Baghdad, as well as the Minister of Health, at provincial level in Kurdistan, working with different society organizations, as well as with the media. And as you know, in Iraq and many other countries, they have many, media channels that we cannot go directly unless the Minister of Health officially is engaged on that. So we seek the guidance and the support from the officials in that country. But the message is well taken from him, and I will definitely take it back to our country represented there in Iraq. Thank you.
Thank you. I'll go to Dr. Tedros to respond to some of the questions, and we'll then have a short final round that panelists can also give a final remark, since we have about 8 minutes left only. Dr. Tedros.
Okay. No, thank you. On the pandemic treaty, I think there are 2 options to contribute. One is through the scheduled programs, and the IMB makes regular invitation for inputs. But in addition to that, you can also send your inputs directly to the IMB, even if there is no scheduled consultation program. And it's between now and May 2024, this generational agreement, as we call it, will be finalized. And we will work with the committee, which is composed of member states, to open up more consultation with especially civil society. But I think, having learned lots of lessons from the pandemic, I think having a pandemic accord, agreement, or convention is going to be very important to address the challenge that we have faced during this pandemic. And there is agreement by member states that the agreement should be legally binding, which is a good news. But still, the content will matter at the end of the day. and we want your influence in having a good content. Then on participation of governments, as our board chair, Dr. Petric said, I think she left, but
back there.
Well, I was looking at the chair where you were sitting. Okay, so what she said is right, but I think as Gowden said, it would be very important to bring it to the floor of the board meeting. And she's holding a retreat of board members soon. I think even raising it there would be very, very important. So thank you so much for raising this very important issue, Dr. Petric. And then I think many of the things you said, like the sign language or the other more engagement, including financing civil society, we have already started financing. It's a matter of doing more, but as WHO, as you know, we focus more on technical advice, technical support, and our resources are limited. But what we try to give you is some kind of catalytic, and mobilizing other donors to help you will be very important, and we will make it our focus, because without resources you cannot operate. And many of the other, I'm on long COVID. I hope you have read the article. It's already real now. It's real. That's what the world should understand. But we need to do also more research to see if there are variations from country to country. That the government's role is going to be very big on this. And in the article I published last week, that was what I was trying to underline. And we cannot do it without your participation. And look forward to engaging you, starting from research. Many other things that we're planning to do on long COVID are being outlined now, but constant and regular engagement will be very important. On civil society engagement, I don't think it will be successful what we do, or our collaboration will not have really a good impact unless our partnership, WHO's partnership, is created at all levels with civil society, country, regional, and headquarters. On specific issues, for instance, like TB, we had a joint statement, and we have, we're designing it exactly like you said, but our regional director is here. But the strategy is to use all levels of WHO, engage at all levels, especially the country level is very important. That's where we expect, where we get result at the country level. So that's already in the making, but we will work with you since we have this civil society commission now formalized. The engagement at all levels should have clarity and should get input from all of us. And we will listen to you on how the levels of engagement at all levels should be. But that formal structure will help us to go into some specific agreements. So you have a say on that, although some things have already started. The trust issue is very important. I mean, I cannot say just only social media, but the impact of social media in misinformation, disinformation was serious. You remember we have been saying a number of times, actually, there's two pandemics now. One is because of the virus itself, and the second one is the infodemic, or the misinformation and disinformation. But trust, I think for trust to be, trust is normally earned. It cannot be because you say talk to people and ask them to trust you, they will not trust you. And there will be factors that will help them to understand whether they trust you or not. But from our experience, one thing we have seen is when the cabinet or the government is science friendly and then the government listens to the experts, scientists, and communicates with its people, with its citizens, then there is a good level of trust from the people. And we have seen that, by the way. One good model is Singapore. And even some ministers we met, the foreign minister we met last week, they call themselves science friendly, which is really important. So that's very important. How do we make sure that governments do not interfere in science and respect their experts, and that they're science friendly, and that they communicate with their citizens based on science, and they tell it honestly, what they know, what they don't know, without holding back. In government, in countries where that has been done, I think there is better trust. So in the interplay, it's not between health institutions and the people. There is the government also, which can have a big role. And then, of course, there is the civil society, which can also contribute to that. So my advice is, what do we learn? What did we learn from this? And then how do we design the model going forward in order to build trust? But your input in this will be very, very important. We need to have engagements, constant engagements, to create the model that works in order to build trust. But that's very important. Involvement of local, I think with local civil society, it can be covered with what I said. When we design how to engage at regional and country level, then we will address also the question from our colleague from Iraq. The challenges you said are being seen, and I fully agree. We don't put civil society and private sector on the same footing. Maybe what I said, if the misunderstanding was coming from what I said, is all members of the society, civil society, private sector, government, academia, all should participate based on the comparative advantage that they have. But I don't think private sector will replace civil society, and I don't think it will be right to treat civil society with private sector, especially when tobacco we don't even talk to each other. So what you said at arm's length is true. So these are, I think, some of the issues. If there are issues I haven't addressed, it's better if we take them as recommendations. The questions, I think, look like recommendations. Why don't you do this? Why don't you do this? You can just convert them into recommendation and make progress based on the inputs and advice that you have given us.
Thank you very much, Dr. Tedros. Thank you to all. Time is nearly up, but I want to give to the panelists from civil society the last word. You have each one takeaway, one sentence to what do we take forward? And we start on the other side with Kaylin.
Perfect. Thank you very much. I think the main key take-home message for me is that we absolutely need to very closely look at the civil society engagement mechanisms that are being brought forward, and ensuring the commission, the youth council, and ensuring that those address a broad participation of civil society, including organizations that are not selected for these committees, both at the global and regional level.
Thank you, Kurt.
Yeah, thank you for the opportunity, and thank you for the meeting. My questions are already answered. I just want to say that we praise what Dr. Tedros said, and we will keep you accountable for your commitments today.
Thank you. Peter, yeah.
Yeah, I think the member states point is really important, and really keen on working with people in this room to make sure that we're tackling member states and civil society engagement, and most importantly on the notions of expertise, that expertise is binary, very important, and looking forward to working with you all on that.
Thanks a lot, Marionka.
Yeah, thank you very much, Dr. Tedros. Thank you all for having the chance to represent Save the Children here. For me and for us, it's key that civil society engagement and children's participation is key in the foundation for strengthening health systems with a primary healthcare approach, both for strengthening UHC, universal health coverage, as well as pandemic preparedness. And these are two sides of the same medal. And I think we want to get engaged actively in that and bring in children's voices in the future. Thank you.
Thank you. Thank you to all, and looking forward to continue this dialogue. Thank you.